A place to call home. It's the American dream. Yet statistics show that homelessness is on the rise in the U.S. Although it's difficult to measure the exact number of people who are homeless, in 2007, experts estimated that in a given year, about 3.5 million people would be homeless, with over one-third of those being children. In today's economy, those estimates are increasing. A sharp decline in employment opportunities, lack of affordable housing, and insufficient access to health care are contributing factors.
We see a number of individuals and families who are homeless as a result of some of the economic situations that are occurring within our nation right now. In addition to that, homelessness has had an incredible impact for individuals who have returned who are veterans. So we see a real increase in the number of those. Also, over the last probably 15 years, what we have seen is more intact families that have become homeless.
Though there are many reasons why people find themselves without a permanent safe dwelling, for most people, homelessness is a temporary state. But for people who are homeless and suffering from mental disorders or addictions, the likelihood of re-entering society is significantly decreased.
We do know that probably the largest subgroup within the homeless are those that have some sort of a mental illness, also co-occurring, which means they may have mental illness as well as substance abuse, and they oftentimes are not diagnosed, and that's the reason that they are homeless.
The U.S. Department of Health and Human Services reports that the majority of mentally ill homeless do not need to be institutionalized, and contend that with proper support and stable housing, they can be productive members of the community. Yet many community-based programs for the homeless are experiencing a sharp decline in federal and public assistance, with the majority of funds being allocated to disaster relief. It's a situation that has many calling for communities to support local efforts to treat and house those struggling with homelessness due to mental illness.
Individuals with mental health and substance abuse issues are a part of the community. Everywhere you go, you may not know it, but you're running into people who have these challenges. So we see it as not necessarily working with a subpopulation of the community, but working with the community as a whole. They are productive individuals, they have jobs, they raise families, they access the schools. So it's in everyone's best interest to make sure that they're functioning at the highest level that they can.
Permanent supportive housing operations, like the ones set up by the LifeLink in Santa Fe, are proven to successfully reintroduce formerly homeless citizens to society.
I became homeless after a 20-year marriage, and I was living in a tent for a year and a half, shelters, and they only have 30-day staying periods, and then I connected myself up with LifeLinks, got in with their counseling, and they got me a place and have done really a lot for me.
The approach to really make a difference with homelessness is to not only supply housing for them, getting them into some sort of a safe place, but also the supportive services that go along with that. And supportive services include case management. It includes helping those individuals with disabilities get benefits. It's helping them get a job. It's helping them make some life changes that have prevented them from moving forward in the past.
I'm perfectly capable of getting a really good job. I have a degree, but it's really difficult to roll out of a tent and be ready for an interview, and it's virtually impossible. Well, it's probably not impossible, but extremely difficult. So once I got here, I got my self-esteem back and got a job right away.
Without services like these, statistics show that the mentally ill homeless are less likely to be active participants in their communities and are also more likely to be victims of crime and deteriorating health.
Community mental health centers and substance abuse treatment centers serve a vital role in communities. Without them, the cost to the community in terms of jail time, social programming is immense. Programs like this, regardless of what community they're in, can ensure that these individuals are receiving the services they need and are contributing in a productive way to the community at large.
Everyone deserves a place to feel safe, to live independently, to call home. That's why the LifeLink has been dedicated to providing supportive, independent living housing for people suffering from mental illness and addiction since 1987.
There wasn't a place for families who became homeless to actually stay. I mean, literally, there was no place in town for a family to be housed unless, a church would get them a motel room or an agency would get them a motel room. But at that time, there just wasn't anything available. So that began what I would say is the real start of the agency, the LifeLink. And as time went on, what I found is that there is such a correlation between homelessness and mental illness.
A licensed community mental health center founded in Santa Fe, the LifeLink currently maintains 93 housing units which have provided shelter for thousands of individuals and families over the years, many of whom had nowhere else to turn.
I became aware of LifeLink after I had an accident here in Santa Fe while I was working that required me to have hospitalization for almost 3 months. And I was doing really well. I thought I had the world by the tail here, and then all of a sudden all that changed because of this. And so, circumstances just decimated me. And then I was told of LifeLink and was brought here for interviews and things. And ever since then, they've been so supportive and helped in so many ways to encourage me, which is so great, give you hope and everything else. And so I've been able to cope with things because of that.
In addition to housing, the LifeLink also provides outpatient treatment for a wide array of mental disorders and substance addictions, including support services for concerned significant others who are trying to help loved ones overcome these problems.
The LifeLink is committed to utilizing evidence-based practices for the clients that we work with. Overall, our program can be considered cognitive behavioral in nature, which has been shown across a wide variety of disorders to be the most effective treatment method. We utilize motivational interviewing, community reinforcement approach, integrated dual disorder treatment model, and trauma-specific models to deal with trauma, which is a very important aspect of what our clients are dealing with. One of the things a LifeLink is relatively unique in the country for offering is the CRAFT model for treatment. CRAFT stands for Community Reinforcement Approach and Family Training. What we do with CRAFT, we invite the concerned significant other to come in and talk to us, to discuss some of the issues they're dealing with in trying to get their loved ones sober, some of the things that may be working and may not be working, and help them to develop new tools to make a more successful intervention with the person at home.
The LifeLink is constantly working to expand their programs to continue improving the lives of individuals and families through permanent housing, employment, mental health, and substance abuse treatment.
I'm writing a book about being homeless and coming out of it. I feel that it's, you get in that position and it's almost like a disease that you can't get out of. It's hard to pull yourself out. But with programs like this, you really, if you just try, there's a hand there to help you.
What we've tried to do is really identify an individual as a whole individual, and so that they are someone's parent, they may be someone's brother and sister, they're a son, and that there's more to them. And once they become really able to sort of appreciate their own value and what they can contribute, then the real recovery begins. At the end of the day, it may be really hard, but I feel like we've made a difference, and I think the LifeLink has made a real difference in this community.
Help make a difference in someone's life today. Support the LifeLink. For more information or to pledge your support, call 888-402-0970 or visit thelifelink.org.